What is HPV and how does it cause cancer?
HPV, it is human papilloma virus.
What is the biggest myth about HPV and cervical cancer?
It's not preventable. How does it cause cancer? It's not like you get HPV infection and you get cancer immediately. No, it is a continuous process by which the virus affects the normal cells of the body.
Is cervical cancer one of the most preventable cancers today?
Absolutely.
Hey there, I'm Aishwarya and today we have with us Dr. Annie, Associate Professor, Department of Medical Oncology, St. John's Medical College and Hospital, Bengaluru. And the topic of discussion today is HPV and cervical cancer. Let's get started. Hi doctor, welcome to the segment doctor. So there's been a lot of discussion around HPV lately. So what is HPV and how does it cause cancer?
Okay, so HPV, if you have to expand it, it is human papilloma virus. So it's a virus.
Okay.
And how is it spread? It is by intimate skin to skin contact. And how does it cause cancer? So it's not like you get HPV infection and you get cancer immediately. No, it is a continuous process by which the virus affects the normal cells of the body, that is in the cervical area, and it causes the normal cells to go into a dysplastic cell. That means it is going into an abnormal cell. When that infection goes on and on and on for a long time, that's when the normal cell converts into a cancerous cell.
Okay.
So the process is hastened when the virus is there.
Okay.
So basically, the normal cell converting into a malignant cell, that's a cancerous cell, that is hastened by this HPV virus.
Okay. Why is cervical cancer still so common among women?
So I would beg to differ with that because if you look at the data from probably 5 to 10 years back, the incidence of cervical cancer was pretty high, and especially in a rural setup. But now that is slowly changing. You would if you look at the numbers now from the Globocon data or the ICMR data, you see the numbers are decreasing. Why? Because there is a growing awareness that is coming in for cervical cancer, and still probably the numbers are still high where the females are uneducated. They do not know about this virus. They do not know which is the time they should meet the doctor, when they should go for the screening. So probably in those specific areas now, it's still showing some numbers on a higher side. But if you compare it, like I said it earlier, 5 years before, it is definitely coming down. People are getting more educated and more NGOs are coming into picture. More and more government hospitals are taking in, and also WHO has actually made it one of their goals in coming years to completely eradicate cervical cancer, because India had pretty high numbers compared to the West, and it is because of this HPV virus infection that the females get because of poor hygiene. There are different factors, very early age of marriage and deliveries happening at home where the the sterile precautions are not taken. So all these matters actually were causing this cervical cancers to be on a higher scale. But with the advent of more awareness and females coming in the hospital early, going for pap smears, the rates are coming down, and that is actually quite encouraging for us, because when you diagnose someone in an early stage, it's pretty much curable compared to those who come in stage 4. So I would just beg to differ with that statement. It's a little promising that yes, we are going there, we are on the pathway, but still a long way to go.
Okay. So what are the early signs or symptoms that one can notice?
So one is females have a normal discharge, and the consistency varies during their menstrual cycle. Everyone must be aware of the consistency. It is white or it is thick in some part. In early stage during ovulation, it is very I would say transparent, which is you can elongate, and then just before your periods they get a very thick white color discharge. Any difference in this, that is you have bleeding apart from the menstrual cycle.
Yes.
Then there is foul smelling discharge, which is there. So these are one of the earlier signs. This is where the female should go and probably take medical help. But we would not like to see the patient when they have these symptoms.
Okay.
They should actually go in much
Report
earlier,
prior.
report prior, and that is why the screening strategies, if you look at right now, every female who goes for their general checkup, they have their pap smear done.
Okay.
This is the reason why you should pick up cervical cancer at an early stage, even when they have not transformed to cancer.
Okay.
There is something called a in situ cancer which is there. That means it is going there to the cancer. If you catch them in a carcinoma in situ stage, it is like very, very high cure rates. Even if it has transformed into a cancer, like stage 1 or 2, it is very, very much curable. Your question about what are the symptoms that they may have, by the time they come with symptoms, it is actually progressed. So that is why awareness about that, to just go for your health checkup, is very essential.
Okay. But as you mentioned, bleeding is also one of the symptoms where you can detect it. So how would you differentiate between the normal menstrual bleeding versus the one which is probably causing the cancer?
So generally your menstrual cycle is 28 plus minus 7 days.
Yes.
Any intermittent bleeding, that is out of the clock bleeding, should warrant. And first thing is the foul smelling discharge. The discharge is extremely foul smelling, and sometimes it may be due to the infection, but you should always get yourself checked. And there may be some lumps coming in the groin area. These are all signs that it has really progressed. And sometimes, when it progresses, because it goes into the your bladder, it goes and obstructs the kidney, that is the ureters that is there. The patient may actually have decreased urine output. They may have swelling of the feet. This is our extensive stages of cervical cancer. So that is why we are promoting that you should get the pap smear checked. You should get yourself examined as soon as you hit probably post 40. And get yourself screened. In fact, now with the vaccines that are coming in, generally people, at least multi-paris, those who are married, get the pap smears and all done. So this is where probably this type of educational sessions actually help, so that they understand that don't wait for the symptoms to come, but get yourself checked. Just like in breast cancer, we now tell them just go for your check. If you find some lumps and bumps, you should get yourself checked. But cervical cancer may not have, the in situ may not have much symptoms actually. So you go in for your pap smear. And pap smear, if there is any atypical cell that is probably indicating that something is going wrong, then they evaluate further. So we should go and get yourself checked by a gynecologist, get the pap smear done. These are something which is, you can catch it early. So I would say that make it mandatory, just like you go for your probably health checkups, blood test. Probably now everyone is aware. I did my yearly checkup. The females, I would encourage them to get themselves checked also and get a pap smear done mandatory.
So is there like an approximate age bracket that you
generally those who are sexually active, we tell them to get checked initially post 35. 30 to 35 you should start. And especially if you had pregnancy earlier, where you have not shown a doctor, pregnancy at home, history of this discharges, infections. It may not be cancer, but sometimes foul smelling discharge may be actually genital infection also that may be present. So if you go there, those who have history, you may go and meet them earlier. But generally we say that 35 to 40 get yourself, start at least the examination and all done.
Can HPV infection remain silent for years?
Yeah, so like I had mentioned earlier, it is not that one day you get HPV infection and the cancer comes in the second day. It's a continuous process. So the virus goes on changing the anatomy, physiology, and the functioning of the cell, and it causes dysplastic changes. What is dysplastic? The cell is not, all of us have some bodyguards in our cells that protect us from cancer. All of us are gifted by that. Now what this virus does is, the guardian genome in that cell, it causes constant hit to that guardian genome of our cell, and that is when the cell, our guardian just gives up and the cell converts. So this process takes a while. So it is not a one day thing, so it may be silent. it may not actually give you symptoms upfront.
Mm-hmm.
It will probably depends upon how indolent or how aggressive your virus is infecting the cells. Based on that, the timeline differs, but it can be latent. And in patients who probably have who get probably retrovirus and stuff, in them the process gets hastened.
Okay.
So that is the reason again and again we say that go and get yourself checked.
Okay.
So because HPV virus infection will not manifest itself right on the first day. It is a continuous process, insult to the cell. And it's not just cervical cancer. Anything area in the genital area. So for the females, it may be vaginal wart. It may cause. It may not just cause your what do you call it, the cancer. There are many other lesions, precancerous lesions also that may come in.
Okay.
So warts is one of it. So vaginal area, or in males, if they have high risk behavior, anal area also the warts may come in. So these are some of the things. It protects not just for cervical cancer, but surrounding urogenital area as well. And these warts, certain lesions that come in, this may be some of the early things which may come, because when you go to the derma, suppose someone has got a wart, they go to the derma, they get it excised, and then you look it under the microscope, and then there will be some features under the microscope that will indicate probably this was an infection. They will do some markers, and that will help us, come to a conclusion that probably this was something to do with the virus.
Okay.
So it's not just cervical cancer that the vaccines help, because it is the anal area, other areas also in the urogenital system where HPV can affect.
Okay. Is cervical cancer one of the most preventable cancers today?
Absolutely, because see, prevention is better than cure. You don't get the infection, you're not at a high risk.
Of course.
Okay. So it is one of the preventable cancers, just like hepatitis B that we all take. Similarly, because your hepatitis B infection does not translate into a liver cancer. Similarly, all HPV infections may not convert, but it may give to some precancerous, some of them going into cancerous. So here you're trying to remove the root cause that is leading to cervical cancer. So obviously it is one of the most preventable cancers as of now, and this should also send this message for the entire the people around, that they should let their girls, young girls, as adolescent girls, to go and take this vaccination, because it is better that the vaccination is taken before the girl is sexually active. There are many females who are taking it later. They have said that at least it will help in some magnitude, but it is of maximum benefit when you give it at an early age. That is the age at which it is recommended right now. It is from 9 to 15. So you should get them started pre-puberty.
Okay.
One is they're just hitting puberty, and nowadays if girls are becoming sexually active a little more at a younger age, it is preferable that they take the vaccine earlier.
Okay.
So that the body has developed the immunity to protect them against the cervical cancer.
Okay. How important is the HPV vaccine for cancer prevention?
Yeah, so it is you're probably needling out the root cause by helping the body to be better, I would say they're strengthened, or they have armor around them against this cancer. So you don't get the infection, you're not at a risk for getting cervical cancer. Yeah. So that's how the HPV vaccine helps, because it is now I would also like to say there are two different types of vaccines which we now are giving in India. One is a bivalent vaccine, one is a quadrivalent vaccine. It is, I would not go into the details, but it is, one takes care of the two common serotypes, the other 4 serotypes. That's why it is quadrivalent. Okay, and generally how do we give it? There are 2 doses. You give it at baseline, and then you give at least, there is a range by which you can take the second dose. Okay. It is at least, they say that at least 1 month after the first dose. Minimum timing between the first and the second dose should be more than 1 month.
Okay.
Okay, and I would say third dose, it's not that recommended, but some people do say it. Probably once it comes into our ICMR guidelines, it will be more strict in that terms.
Okay.
But generally it is two doses.
Okay. Who all should be vaccinated and when?
So, like I said,
We
all
already spoke
sexually
about, yeah.
active females should receive it, and preferably the girls before their sexual activity begins. It is just like, you know, for influenza vaccine, we say before the winter comes, you give it to your parents. Why?
True.
Your body should develop the antibodies,
Yes.
so that it
Immunity.
fights, and don't give it when the
Yeah,
winter
yeah,
starts,
when
because
it's already
it's
late,
of no
yeah.
use. It's similar to that. Your body needs some adaptation to the vaccine that comes in to develop the antibodies against the cancer.
Got it. Can a simple pap smear actually save lives?
Absolutely. So, pap smear is what? You take the cells from the cervical area and examine it. If the cells are normal, you don't have to worry. If the cells are abnormal or probably in the gray zone, you know something is going wrong. So, you know, you have to, your antenna should go up. Okay, either this is infection or I need to get a repeat pap smear scan. So, a simple tool. Just take the scrapings from there and see it under the microscope. So that will give you a picture what is happening inside you. Then accordingly we can do the relevant scans.
So it's definitely beneficial,
Yes.
right? Yeah. What is the biggest myth about HPV and cervical cancer?
So the myth is it's not preventable.
Okay.
Many people say that why are you giving vaccines? It has other side effects, just like the COVID ones. That person got this COVID vaccine, they have other side effects.
Yeah.
So this is a normal myth. Why should we take the vaccine? There are so many side effects.
True.
But you should always look at the bigger picture. It will not give you the benefit immediately, but in the long run, it will help.
Prevention is better than cure.
Yeah. So, and the other myth is, if you have got cervical cancer, people think, oh, they may have done something wrong. That is why probably they have got cervical cancer. Okay, that's not the case.
Yeah.
Okay, I mean, there are other infections. Just infections actually also can predispose you to get cervical cancer, because like I said, in the rural area, there are girls who get married at a very early age and then get pregnant at a very
Correct.
early age, and the deliveries don't happen at home. You don't know about the sterility that the people take during the delivery. So these are the things. So it's not like someone is diagnosed with cervical cancer means that they have, oh,
Yeah, you have
oh,
to
you
like
should see where, I mean, you should not have
view them
stigma. So
differently.
yeah.
Yes,
No,
yes.
the stigma has to go. Okay, so this is what, and it is preventable. That is the first thing. And if you catch them early, that is precancerous stage, that is in situ stage, or at an early stage,
Okay.
probably stage 1 and stage 2, they are extremely curable.
Okay.
And now, even if someone is unfortunate to come at a later stage, there are modalities by which you can actually treat them.
Okay.
Of course, in stage 4 cancer, it is difficult to cure, but with the latest immunotherapies coming in, they're absolutely, you know, the quality of life along with the increased survival, we have a lot of options now. Just that the stigma should go, you know, because as soon as the label of cancer comes in, people are like, oh,
Alarmed,
yes,
saying it leads
it's
to
like
death.
it's like they relate it equivalent to, you know, death sentence,
Death,
gone.
yes.
But that should not be, because cancer is now becoming like a chronic disease, just like diabetes. You go on for tablets, then go for injections and all that. So similarly, I mean, we are getting educated and we are having new innovations, new treatment modalities also are coming in. So obviously the hope is there. So the stigma has to go.
Totally. So what is the impact of AI on the space?
AI in cervical cancer?
No, as in like in terms of treatment, is there any advancement because of the inclusion of AI, or I mean early detection, or
So
has
AI
it been
actually
useful
can
in any
help.
space?
So sometimes we may face difficulties in early stages. Okay, in early stages, sometimes it is not clear cut that it is gone into a cancerous stage. Like I was telling, there are some pre-cancerous stage. So AI may actually, you know, come into the space there where it takes in the histopath report and the radiological report and tell me the percentage as to how much the chances of it being malignant or turning into malignant can come in. So I would say it is coming in, it can come in early stage. Though your question of AI in cervical cancer, people are looking into it, but not yet come into the space.
Okay.
And also other factor is, if they are in a stage 4 and they have other extensive disease, the response, what response can we, get through some modality, it may predict.
Okay.
But as of now, it has not come into like a solid thing in cervical cancer per se, because we are still getting educated. It is come in lung cancer, it is coming in breast cancer, and people are taking in. But in cervical cancer, I would say one space is early stage precancerous. By its computations and stuff, they can tell us which can convert into an aggressive biology that may give us an idea.
So what difference has immunotherapy made in this regard?
Okay, so immunotherapy is a major advancement in cervical cancer, in extensive stage 4 cervical cancer. Earlier, we just had chemotherapy to offer to our patients, and probably later on something called VEGF inhibitor came into the picture. But now immunotherapy has actually conquered the space. Why? Because cervical cancer has a lot of antigen exposure on the cells, which can be, targeted by immunotherapy. So immunotherapy attacks those cells, and cervical cancer is generally squamous, and they respond beautifully to immunotherapy. So now, apart from chemotherapy, we have VEGF inhibitor and immunotherapy which has come in, which has improved survival rates, good response rates, along with maintaining quality of life. So immunotherapy also has made advancements in terms of an antibody drug conjugate. So this is what is happening in the West. Probably we'll get it in India in some time, but even after immunotherapy, we have another cellular therapy which is coming in. So this space is pretty exciting. With immunotherapy also, we get durable responses. So, and the toxicity profile is much more manageable compared to chemotherapy. They don't lose hair. Females have the biggest question, oh, my hair is gone. And they are like, so immunotherapy, they have their own bag of autoimmune side effects, but yes, the profiles are pretty much manageable, and we can continue on therapy for a longer time. So just like, like I said, in chronic diseases, we need to maintain some amount of therapy so that your diabetes is under control, hypertension is under control. So similarly, in even stage 4 cervical cancer, now we are spoiled for choices for immunotherapy, that we give them after some kind of an intensive protocol, we put them on a maintenance. And it goes on. And it was unheard of getting years of benefit. With something called a progression-free survival we talk about, that means the disease is kept under check, and the person is able to lead a life. But cancer tumor cells are also pretty smart and intelligent. They will circumvent whatever we give, and so we have some things in pipeline probably in those patients as well. So we also become a little more smarter for some time, and so that after, even if immunotherapy fails, we have next line ready. So that's how we are evolving. Oncology is ever evolving space, and hope we are able to give good survival along with quality of life.
Thank you so much, doctor. That was a great deal of information. Any final message to our viewers?
Yeah, so what I want to say is, don't have stigma associated with the word cancer. Cancer is not a death sentence, but the key is, get yourself checked. Don't wait for symptoms to come, because early detection saves lives, and cancer in an early stage is extremely curable.
Thank you so much, doctor, for sharing in-depth knowledge regarding the risks, causes, and preventive measures related to cervical cancer. It was great connecting with you.
Thank you.
And to the audience, thanks for watching.